Welcome back. My next guest is Dr. Victor Marwin, who is an orthopedic surgeon, specialty in upper extremity with Bluegrass Orthopaedics. Welcome.
Thank you.
Well, now this time of year, it's slick, people are falling, and I'm going to use the acronym some doctors use, patients use, called a Foxx injury. Tell me what that is.
So that stands for fall on outstretched hand, and you're right, it's fracture season right now, so everything's covered in ice. Some people may not be used to it. It's new, this cold snap that we're having, and it can pose a lot of problems for people.
So you fall down, you got that arm extended, and boom, you hurt something. But how do you know if you broke something, or it's time to see the doctor, or is there clues?
Yeah, great questions. So the reflex is to put your hand out and prevent your fall, right? So when you put your hand out, you have that fall onto an outstretched hand, and if the stress is strong enough, if there's enough energy, it can break your wrist. The main wrist bone that's broken is the radius. So the radius is one of your forearm bones. It's on the thumb side of the wrist. That's a large bone that is most commonly broken when you fall. There are also smaller bones in the wrist called the carpal bones, and those can be subject to injury as well. Less common than the radius, but they can also be injured. And there's one bone in there called the scaphoid bone, which is particularly susceptible to trauma. Symptoms of a broken wrist: you've got pain, you've got a deformity, you have trouble moving the wrist. Those can all indicate that you have a significant injury, and the tendency is to kind of minimize that a little bit, but it should be investigated if the symptoms are bad enough.
Well, now you mentioned investigation. There's different ways to do that. Your primary care doctors, the ER doctors, but you also have a clinic that maybe can shorten the time to treatment or make it more convenient.
Yes, we have walk-in urgent care at our Yorkshire Medical Park location in Lexington. It's BGO Now, so the website is very easy. It's BGO NOW for bgonow.com. They have our hours there. We have hours Monday through Friday. You can walk right in. On Saturday morning there are hours. And really the big advantage to that is you eliminate some unnecessary steps. So if you go to your primary care doctor, they'll see you, they'll get an x-ray, and then they might refer you out to somebody that could take care of it or offer different treatment options if it needs to be casted or fixed. And the ER does similar things. They'll see you, you might have a longer wait, but ultimately they're going to try and refer you to somebody like me or one of my colleagues. By coming directly to us through our walk-in clinic, you can skip those steps and save yourself some time. And really, it's good to see an expert from the start, because as you mentioned, a lot of people don't really know exactly if they have an injury, and that goes for some medical practitioners as well. So oftentimes people can come to an emergency department or an urgent care and there are missed fractures. And it's not because those people don't know what they're doing necessarily, but it's hard to really see those unless you're an expert. And you might have to get some follow-up imaging as well. So it's good to go to the source.
Now you mentioned a fracture, so let's say it's there. What are the treatment options?
Sure. Yeah, a lot of fractures can be treated non-operatively. So if you have a fracture, we have to stabilize it somehow in order to get it to heal. And a lot of times that means a brace or a cast if it's non-displaced, or if it's minimally displaced and the alignment is acceptable. You typically don't need surgery for something like that. Other fractures that are more obvious, where somebody has a wrist deformity, might require surgery, or at least to line the bone up a little bit better. But some of those fractures, the ones that can be missed, they may require some follow-up x-rays, and they might not be as obvious. You might have to get some advanced imaging, and that can be made on a case-by-case basis.
So you get treatment. There's always side effects, or can be difficulties, treated or not, with follow-up fracture. What would they be?
Sure. So some of the side effects that can happen if you miss a fracture, most commonly, the bone will heal, but it'll heal in bad alignment. So we call that a malunion in orthopedic surgery, and that can have implications for function. So if your wrist, for example, were to heal in a bad position, the bone will heal in most cases, but function will be compromised, and you can have worsening arthritis, poor range of motion. And then if you have to have surgery later to have it treated, it's often a lot more complicated. The other thing that can happen is that the bone doesn't heal, and that's called a non-union. And that happens with some of the smaller wrist bones that I mentioned before. And oftentimes people will have a fall, they think they have a wrist sprain or some other minor injury, and they got on with their life, and then they end up having wrist pain that persists. They come and see somebody like me, and we get an x-ray and they have a bad problem that now needs a lot more extensive surgery. Sometimes they need bone graft in there, and it can be a much more complicated process that could have been prevented.
Okay. Is there anything to prevent
It's common sense stuff. So I like to tell people be liberal with the ice melt. Put the chemical ice melt down, make sure it's on your stairs, and really operate under the assumption that in weather like this that is uncharacteristic for the area, there's going to be ice. And there's going to be ice that you don't see. So, anecdotally, a lot of stuff that I've seen recently in my clinic, people go out to the mailbox because they forgot to get the mail, and they're running out there, and they got a lot going on. Ice at the end of the driveway, they slip. People are taking a last-minute bag out to the trash can. Assume that there's ice, and assume that there's ice that you can't see.
We appreciate you coming in, and thank you for all you do.
Thanks very much.
And if you're out there on a slick sidewalk, be careful. You may have to see Dr. Marwin. We'll be right back.